CDC has released estimates of variants across the country and predicted the Delta variant now represents 83% of sequenced cases. This is a dramatic increase up from 50% the week of July 3rd. In some parts of the country, the percentage is even higher, particularly in areas of low vaccination rates.
All right, that was CDC Director Dr. Rochelle Walensky speaking on Capitol Hill yesterday, talking about the Delta variant. And the question a lot of Americans are asking now who are vaccinated, will we need booster shots at some point, perhaps as early as this fall? Joining us now for more on the vaccines is trauma surgeon Dr. Manny Sethi. Dr. Sethi, good morning. Nice to have you on.
Hey, good morning. Thanks for having me.
It's our pleasure. Doctor, the U.S. has seen a 70% increase right now in coronavirus cases over the last few weeks. That's according to the CDC. What do people need to know about this new Delta variant?
Well, I think what we're seeing right now, and again, every day we're going to learn something new, but I think the Delta variant is highly contagious, more contagious than the original strains of COVID-19. As you just heard, about 83% of new cases are this variant. And I think people are getting sicker. It's targeting younger folks. But something you said I think is very important. The number of breakthrough cases that we are seeing across the country now are fairly high. And we just have to ask ourselves, how effective are the current vaccines to this new variant?
How concerned should we be, really? There's always a variant that is the dominant variant in the country or in any country. But the key numbers, the key metrics, hospitalizations and deaths, those numbers aren't rapidly increasing like we saw, for example, a year ago. How concerned should people be, particularly people that might not be vaccinated?
Well, I think, as you said, folks who are vaccinated, who have taken the, who've had the vaccine and have a breakthrough infection, for example, lower risk of hospitalization, lower risk of death. And in general, if you're vaccinated and you get that, that is true. So what I would just tell people is, look, be cautious. If you're not vaccinated, talk to your physician about the options. Make your own decision. Don't be bullied by the government or anybody else. That's a decision for you to make. But I think with this Delta variant, what we are seeing, it's a little more contagious. And people who don't get the vaccine are more likely to end up hospitalized or could get really sick.
Doctor, I wanted to ask you about the vaccines and how long they last, particularly the Pfizer-Moderna vaccine. That's what the majority of Americans have taken. Early reports say they could last around 8 months. Do we know when they start to become less effective, and does that equal a booster shot at some point?
I think that's a great question, and I think the answer is we just don't know. So I'm a trauma surgeon, and I live in the land of, you just don't know what's going to happen today. I could have nothing going on. I could have a train wreck. Anything could happen. Right. And so similarly with this vaccine and with COVID in general, every day we are learning more and more. And so what I preach to folks is just, look, we got to take it day by day. We can't make, large decisions based on minimal data. We got to follow the science. And I think that's what's important. It's just making careful, thoughtful decisions, not just on the daily trend. And as you said, look, right now, this Delta variant is the most prevalent one, but soon it could be Lambda. It could be another variant.
Exactly.
And again, we've never seen this, so it's every day we're learning.
We are running out of letters in the Greek alphabet as we go through these different variants. Just a quick question. We only have about 30 seconds, but the American Academy of Pediatrics says that kids over 2 will need masks in school. I'm wondering why, because we want to follow the science, and I think people are fine with doing that, but why aren't the CDC, the American Academy of Pediatrics, and other organizations, why aren't they in lockstep? Why aren't they on the same page?
Because I think nobody knows. And so, for example, I disagree with that. I think I don't think children should be wearing masks in schools. I think we've shown that it's hard to transmit this disease to children. I think the data has borne that out. So I think the reason why the AAP and the CDC are not in agreement is because these are arbitrary decisions based on fear or other reasons. They're just not making thoughtful decisions, in my opinion.
But your advice is definitely to get vaccinated. Is that accurate?
Well, my advice, would be to talk to your physician, especially if you're immunocompromised or you have medical problems. You're over the age of 50, 65. I do think that you should get vaccinated. I think the younger folks, as more data comes out, just watch that, be thoughtful. Don't let anybody bully you into doing anything you don't want to do, but certainly make a careful, thoughtful, prayerful decision with your healthcare provider.
Appreciate it. Dr. Manny Sethi, nice to see you. Thanks so much for coming on.
Thank you. God bless.
Hey, I'm Rob Finnerty. Thanks for watching. If you enjoyed this video, please join the conversation in the comments below. Don't forget to subscribe, too. Hit the bell icon to be alerted to breaking news. And remember, there's a whole lot more on Newsmax TV, America's fastest growing cable news network. Newsmax TV, where real news for real people.